your health insurance premium is about to go up. And it has nothing to do with your age, your job, or your last checkup. It's because of a political move you probably didn't vote for. Tariffs. They are almost the only thing everyone is talking about. But what if I told you those taxes on foreign goods could raise the cost of your insulin or shrink your insurance coverage? So tariffs are taxes that one country places on imports from another country. The idea is to make foreign goods more expensive so local businesses can compete. That's the theory anyway. But what happens when 30% of US medical supplies come from the overseas? It's like taxing your own hospital. Add tariffs, and suddenly those supplies are more expensive. And guess who picks up the bill? You got that right. You or your insurance company. Let's talk about insurance. About half of us get it from work. Some buy it themselves, and others are on Medicare, Medicaid, or military plans. Sounds like we've got options, right? But here is the kicker. Tariffs can hit all of these, whether it's your hospital's new MRI machine or that blood pressure med made in India. If it's tariffed, it's taxed, and the system passes the cost up the chain. Let's say your hospital pays more for syringes due to tariffs. They pass that cost to the insurance company. The insurance company does what? Boom, your premium goes up. These aren't hypotheticals. Hospitals have already reported paying a lot more because of tariffs on medical gear. And when supplies cost more, the hospitals cut back, meaning you get billed more for what you get. Medicaid and Medicare are not immune at all. Rising drug costs from tariffed ingredients can raise government spending. This could lead to tighter budgets and less generous benefits. All right, so far we've talked a lot about theory. Tariffs go up, costs go up, premiums follow. But what does that actually look like in your life? Let's run some real world simulations because this ain't just policy, it's reality. Let's start with Alice, a young woman working at a mid sized tech company. Alice has got decent job benefits, employer sponsored health insurance with a $300 per month premium. Cool, right? Now, the hospital her insurer contracts with, their operating costs just jumped by 12% thanks to tariffs on Chinese medical gear. So, what does the insurance company do? Of course, Alice will get an email. Your plan is changing. Premiums will increase. No raise, no warning. Just more money leaving her check. Has your employer raised your health premiums suddenly? Tell us in the comments. We are gathering receipts. Let's look at Kelvin. Kelvin is on a cholesterol medication made from ingredients imported from India. But wait, a new tariff was slapped on Indian generic. Now Kelvin is dumbfounded by the surprise bill. Kelvin probably has to switch med, see his doctor again, or pay out of pocket, all because of a tariff he probably didn't even know existed. Or do we talk about Lisa, a single mom with 2 kids on Medicaid? Lisa's daughter needs a wheelchair. Medicaid would normally cover it, but the chair, built with imported aluminium from China, it now costs 25% more. Lisa gets on call with the hospital administrator, and what she hears is this: we had to delay Medicaid equipment approvals due to budget constraints. State Medicaid budgets are tight. They can't bear the cost, so they delay approvals or stop offering certain devices entirely. Lisa now has to wait months or try crowdfunding to get her kid basic mobility. That's the tariff ripple in action. Or Mike, a small business owner in a warehouse. Mike runs a small business with 15 employees. He offers a basic health plan, but with rising supply and insurance costs, he can't keep up. Soon, Mike is in the boardroom saying, we can't afford to offer coverage anymore. Now his team is uninsured, sent scrambling to the marketplace. Premiums are now higher. Networks are narrower. And guess what? One of his employees, Maya, has a chronic illness. Her new plan won't cover her meds. Just like that, a business trying to do right gets squeezed. Families feel it the hardest. So what are we looking at here? More expensive plans, fewer covered meds, longer waiting times, more uninsured people. Which of these scenarios hits you the hardest? Or maybe you've lived one. Share it in the comments. I see you. Let's even reenact an emergency room surprise. A mom rushes her son to the ER with a bad asthma attack. Her name is Sarah. She's doing everything right. She's got insurance. She's on time with premiums. But one night, her son has a serious asthma attack. But guess what the nurses tell this woman? Your guess is as good as mine. We are out of pediatric nebulizers. Those devices, they are made abroad. Tariffs hit them hard. That hospital had to cut back and prioritize adult cases. Now, Sarah's got a huge bill to pay because even with insurance, she was forced out of network by supply chain chaos. Thanks, Tariff. This isn't abstract. These are real people, real clinics, real chaos. This all sounds very heavy. So what can you actually do? I mean, it's easy to feel helpless when it's the US and China fighting it out, right? But let's break this down. First off, read your health plan's annual notice. I know it's like 20 pages, but here is the thing. That's where the real information is. If your insurance company is cutting coverage on medical equipment or raising co-pays on certain drugs, it will be there, especially now when prices are moving thanks to tariffs. A small change in your plan today could mean a big bill tomorrow. Second, open enrollment is your power moment. Look, if prices keep rising because of this trade war, those deductible plans that looked cheap could hit hard when you need a surgery or prescriptions. Be smart. Look at what's actually covered. Ask questions. Compare plans like your health depends on it, because it does. Now, this part is important. Speak up. Seriously, advocate. This trade war is not just about economics. It's about people like you and I, struggling to avoid insulin and pay for surgical tools. So write your rep. Most people don't even know that tariffs will affect their health insurance. Help them to see this video by hitting the like button. Done? Thank you for helping others and supporting public health. The next time you hear about tariffs or a trade war, remember, it's not just politics. It's your prescription, your ER visits, and your insurance bill. Healthcare is already very expensive. Let's not let trade fights make it worse. Have you started feeling the impact of the trade policy on your health or coverage? Tell us below.